from the great state of Texas. U.S. Senator John Cornyn is with us. Senator, thank you so much. I know you're busy. Catch us up to date.
Glad to be with you.
Absolutely. Catch us up to date on this coronavirus response bill that you guys are working on.
The House passed this, what I consider to be sort of the second installment of what will be at least a 3-installment piece of legislation or series of legislation. They just got it to us late yesterday, and we're in the process of looking at it now. And hopefully we can get this acted on this week. There's some different ideas here in the Senate about how to get money to people who particularly are out of work right now faster to try to help tide them over. But our goal is to get that second installment done this week.
What do you like out there? We're hearing a few things about payroll tax relief, even the possibility of $1,000 per person. What do you like?
Well, there's a lot of interesting ideas out there. What concerns me the most is I think most of the big businesses in America have can take care of their employees, and I know talking to some, including the major airlines like Southwest, their goal is, of course, not to lay anybody off if they can possibly afford to do so. What I worry a little bit about is some of the folks who work in the restaurants and the hospitality business and places that are shut down, and how are they going to make ends meet, particularly when they're trying to do their social distancing and exercise good hygiene and avoid this virus.
Yeah, anytime there's a hurricane or a tornado, anything or like this, it's always those on the lower end of the pay scale that get hit first and the hardest.
Right,
and maybe this is going to help. I'm wondering, you get a chance to get all the medical updates sooner than we do. How do you explain this to the people of Texas? Because everybody listening, there's very few people that know anyone that's actually come down with this. How do you prevent the hype, but also don't downplay it? What do you want to tell the people of Texas?
Well, that's the balance that you have to strike. It reminds me back during World War II, during the Blitz of London. They had displayed these signs. You've seen them: keep calm and carry on. The goal is to try to lead as normal a life as you can, consistent with the Center for Disease Control guidelines, which says wash your hands frequently, maintain social distancing, don't get within 6 feet of somebody else, don't shake hands, bump elbows or whatever. But, a lot of what we don't know is, I think, what is roiling people so much in the markets. And there's going to be a huge ramp up in testing availability. But even then, it's been a little bit confusing to people. I know talking to the governor about this, there's going to be some drive-through testing opportunities around the state of Texas, so people who want to get tested can get tested, and you would expect to see a spike in the number of people diagnosed with the virus, because many times people will not experience any symptoms and not even know that they have it. But the best thing for us all to do is to follow those guidelines. If you feel badly, you need to go see your doctor. Otherwise, just be smart about this and try to maintain as normal a life as you possibly can.
And prevent a mad rush to our hospitals. It's already
Absolutely.
Stretched thin.
That's really one of the biggest challenges, because, of course, our hospitals don't have a whole lot of extra capacity for financial reasons. Many of them operate about 95% of their capacity. So that's one reason why this self-quarantine and avoiding big crowds and things like that makes sense, because we don't want to overwhelm our healthcare system.
Globally, there are many countries that are very upset with China. The flow of information following this outbreak that began back in November, there was a lot of data that was manipulated from that country. In fact, the Chinese government even insinuating that American soldiers brought it into their country. Does this story make us look at China differently? I mean, even in the drug sector, with the supply chain of drugs, all antibiotics made in China. There's some issues there, yeah.
I think this is going to change a lot of things in the long run. It's probably going to change the way we work and how many people end up telecommuting. It's going to change our supply chains for drugs, like you mentioned. We're overly dependent on China, and China, as you know, is a closed society. It's essentially a police state where they didn't let the rest of the world know, nor did they accept help from the rest of the world, because they didn't want to be embarrassed in the eyes of the public. But but they continue to do these cultural things like eating exotic animals, including wild animals, and they are then surprised that people get some of the diseases that from these animals. It jumps from the animals to humans, and then it creates a problem like this. We've seen it before with the H1N1, with SARS, MERS, and this swine flu that wiped out about half of their hog population. So I think this is showing some of the basic flaws in the Chinese model of operating, and one that I think will change the way we look at them and deal with them permanently.
Texans are trying to cope through the mixed messages right now. Very few cases in Texas, only 10 right here in the Austin area, but yet we're shutting everything down. Does that send a mixed message? Is that the right thing to do to get out ahead of this? Italy did not do that. Do you think maybe we've tamped it down enough by getting ahead of this, and how do you cope with those mixed messages?
Well, it's hard because we are an open society, and I can tell from Twitter and social media, you have people either unintentionally or intentionally sending contradictory messages out there. And really what we're talking about is the right balance between prudence and preparation and on one hand and panic on the other. Nobody should panic, but we should be prudent and we should prepare. But I think one of the ways we will stop this escalation of this curve of infections is by following the Center for Disease Control guidelines and the instructions we're getting from the White House about no gatherings in large groups, maintain your social distance, and exercise good hygiene. For most people, that should mean that they are at low risk for getting the disease. If you're of advanced stage or have underlying illness, then obviously you're more vulnerable, and that means if you begin to feel any symptoms, be sure and contact your doctor immediately.
We're up against the clock. U.S. Senator John Cornyn from Texas. This too will pass, right? This too will pass.
It will.
Yeah.
It will.
Thank you, Senator. I appreciate you calling in today. Thank you very much.
Thank you very much.
U.S. Senator John Cornyn on the Todd and Don Show.
The Todd and Don Show.
If you own